More than 60 million Americans suffer from heartburn at least once a month. According to the American Society of Gastroenterologists, 20 million of these people will develop at least one ulcer in their lifetime. Good evening. My name is Brenda Eder, and I'm a licensed practical nurse who holds a certification in gastroenterology nursing. I work full-time in a small rural hospital where I practice in my field every day. I attend continuing education on an annual basis, and therefore I stay current in my field. Today I will speak about contributing factors to the development of stomach ulcers, and perhaps you will walk away with the knowledge to prevent one from occurring. After all, chances are you or someone close to you will develop at least one ulcer in their lifetime. First, I will talk about how ulcers develop. Ulcers develop when there's a breakdown or erosion in the lining somewhere in your gastrointestinal system, which we will call GI system for short. Ulcers most commonly develop in your stomach and first portion of your small bowel, but they can also develop anywhere in your GI system. Your GI system consists of your esophagus, stomach, and small and large bowel or intestines. Today I will talk about 3 contributing factors to the development of stomach ulcers. The first one I will talk about is the prolonged or overuse of anti-inflammatory medications such as aspirin, ibuprofen, and Aleve. Anti-inflammatory medications produce side effects and stop what we call the prostaglandin cascade. One of the jobs of the prostaglandin cascade is to protect the lining of your stomach. So when you take high doses of anti-inflammatory medications, the less protection your stomach receives. Your stomach has an acidic environment, so when you take a lot of anti-inflammatory medications, stomach ulcers will develop. If you have stomach pain or a burning sensation in your abdomen, you should seek the attention of a doctor. The second contributor to ulcer development is a bacterium called Helicobacter, commonly called H. pylori. These bacteria are found everywhere in developing countries, such as the United States. According to the World Health Organization, 10% of children and 80% of adults can have laboratory evidence of the H. pylori infection, and usually they cause no symptoms. When they do cause symptoms, ulcers can develop. These bacteria are able to reside in your acidic environment of your stomach because they secrete an enzyme called urease that lowers the acid level in your stomach and makes it easy for them to live. But when other risk factors are present, such as a depressed immune system, the bacterium Helicobacter can develop ulcers in your stomach. There is some research that indicates that this is the most common cause of ulcers because of the easy transmission of this bacteria in body fluids such as saliva. The good news is the treatment for H. pylori is a 10-day course of antibiotics with acid-reducing medications as well. This should completely eradicate the bacteria. The third and last contributor is uncontrolled heartburn or acid reflux. Heartburn is when the acidic contents of your stomach backflows up into your esophagus and gives you a burning sensation or pain. This occurs because your sphincter muscle that lies between your stomach and your esophagus is not functioning properly. The tissue lining your esophagus is made of cells that are different than those that line your stomach. So when the acidic contents of your stomach backflows up into your esophagus, it can cause esophageal ulcers. Once again, if you have a persistent burning sensation or pain up high in your chest where your esophagus is located, you should see your doctor. As you can see, it's no wonder that 20 million Americans will develop an ulcer in their lifetime. With the use of over-the-counter anti-inflammatory medications at an all-time high, the easy transmission of the Helicobacter virus, and other risk factors such as stress, alcohol consumption, and smoking, this figure will likely climb. But with increased education and public awareness, we will become better informed and should be able to lower our risk factors. And if all else fails, modern medicine has developed wonderful medications that lower the acid level in your stomach, promote healing of your ulcers, and stop them from redeveloping. I should know. I take 3 of them every day. Thank you.